few centers operating within the private sector. This limited distribution of services constrain equitable access and contribute to delays in the management of cardiovascular and emergency cases. To address this gap, the Ministry of Health, in collaboration with the Ghana Health Service and other implementing agencies, the National Ambulance Service, and other development partners, has adopted a comprehensive plan to expand interventional and emergency services nationwide. First, in the area of capacity building, the ministry has partnered with the Ghana College of Physicians and Surgeons to establish a fellowship program, Interventional Radiology. Funding and scholarships have been secured to support training with attention to equitable regional representation. Continuous professional development programs have also been revised to include interventional techniques for radiologists, cardiologists, and emergency physicians. Additionally, telemedicine platforms are being deployed to provide mentorship and technical support to regional hospitals. Second, regarding infrastructure, the ministry has prioritized the expansion of interventional and cardiac care facilities. 6 regional hospitals are being upgraded over the next 2 years to include CT-guided intervention suites and portable ultrasound system for emergency vascular procedures. The Speaker, most notably, we have set in motion processes for the establishment of 3 new catheterization laboratories, known as cath labs, in selected tertiary hospitals to support interventional radiology, cardiac procedures. This care. Our targets include increasing the number of certified interventional radiologists from 4 to 20, establishing functional IR services in at least media time than 90 minutes. Finally, Mr. Speaker, sustainability is being ensured through the integration of IR-related fully Ghanaian faculty by 2028. Mr. Speaker, the Ministry of Health remains firmly committed to decentralizing interventional radiology and cardiac intervention services as a key element of our national health strategy. Through targeted interventions in training, infrastructure, including the establishment of 3 new cath labs and strong partnerships, we are ensuring that life-saving, minimally invasive procedures become accessible to all Ghanaians, regardless of their region or residence. Thank you.
Thank you very much. Honorable Professor Bayoni, supplementary question.
Yes, Mr. Speaker. Thank you. Mr. Speaker, I asked this question because not too long ago, we lost a colleague, medical doctor, who needed catheterization in the Ashanti region and had to be flown to Accra. So my next question
Honorable Member, when you say catheterization, what do you mean?
That's what the minister talked about. It's an interventional radiological procedure that they can, through a wire, guide into the vessel to remove a clot. So he had a clot in the blood vessel and it was blocking supply of blood to critical part of his heart.
Okay.
And as we speak, this service is not available in any part of the country outside of Accra. And so even from Konfanochi, the person could not make it to Accra and passed away. So there are people from my constituency in Lambuse, people in the Upper West region, the northern regions, who want to hear from the minister. How soon can these catheterization labs be made ready in other parts of the country? But while at it, I commend the ministry for a comprehensive package to decentralize these services. That Ghanaians everywhere stand a chance of surviving if they have
procurement processes. And therefore, I can assure you that very soon, 3 of the catheterization or cath labs will be established across various locations in the country. The difficulty, Mr. Speaker, is that it is my information that these equipment are not manufactured and put in the showroom for sale. It is based on order, and that's the difficulty. So we are at the concluding stage of the procurement process, and I can assure you very, very soon it will be ready.
Thank you very much. Yes, Honorable Dr. Kabilu.
Mr. Speaker, I'm not a medical doctor. And Mr. Speaker, I provide this disclaimer because I'm following from the response the minister gave. Based on the background of this issue and the agency of that particular matter and the seriousness of that matter, I'm sure the minister will not be content in himself to say that very soon, without definity, without certainty, without as to very clear timelines. Even procurement has timelines. Mr. Speaker, I'm sure the people of Lambuse will not be happy with the minister's response that very soon. And the question was, how soon? And the response was that very soon, Mr. Speaker. I mean, that should not stand as an answer in this particular house. We want the minister to provide, just like he provided us in the case of hepatitis B, first quarter of next year. We want that certainty so that people can plan their life around that. And that is specifically the answer we are looking for. How soon? We want definite timeline, Mr. Minister. Thank you very much.
Yeah, Honorable Minister. Personally, until your explanation, I never knew that this is a very important question. So I share with Dr. Kabilu if you can give me specific times.
I entirely agree with you. It's an issue of emergency, and His Excellency the President has given clear directives, and that's why I told you that I told the House that we are at the concluding stage of the procurement. But Mr. Speaker, I've been following the development keenly, and just to share with you, I've already indicated that it is not manufactured and put at the showroom. It will take not less than 2 to 3 months to get the machine fully manufactured. And it's not being manufactured in Ghana. It will have to be on the sea to travel into the country. Give yourself about 1 to 2 months. And so if you add, give or take, we are talking about not less than 5 months. And so, but I didn't want to, Mr. Speaker, but that is the explanation, Mr. Speaker.
Yes. So we will now turn to the normal questions. We will turn to the normal questions, and we will come to Dr. Kingsley Ajimai, member for Buakwa South, on question listed as 86. Dr. Ajimai, you have the floor now.
Thank you very much, Right Honorable Speaker. I seek to ask the Minister for Health what approach the ministry is taking to coordinate data collection, analysis, and dissemination of research to generate evidence-based health policies. Thank you.
Yes, Honorable Minister.
Mr. Speaker, Honorable Member, for the question, which highlights the importance of data governance and research in shaping evidence-based health policy. The Ministry of Health recognizes that the healthcare is data-intensive sector and that timely, accurate, and secure data are essential for sound policy and effective service delivery. To this end, the Ministry is implementing a comprehensive strategy to strengthen coordination in data collection, analysis, and use across the health sector. First, we are automating data capture at all levels of care to replace manual entry, reduce errors, and ensure timely reporting. This digital transformation enhances accuracy and efficiency while freeing health workers to focus on patients' care. It also ensures that our systems are robust, interoperable, and locally managed, so the ministry maintains full control of medical data without dependence on external vendors. Second, we are establishing a national health database under the Health Information System Strategic Plan to integrate data from the Ghana Health Service, the National Health Insurance Authority, and other agencies into one reliable repository for policy, planning, and research. Third, we are harmonizing health data and metadata across all 29 agencies to ensure consistency and interoperability, and are collaborating with the Ghana Statistical Service to align health data with national demographic information for more accurate analysis. The ministry is also partnering with universities and research institutions to apply advanced analytics and big data tools, enabling real-time insight for planning, resource allocation, translation platform, which ensures research findings are systematically synthesized into national policy recommendations. Mr. Speaker, through these efforts, the ministry is building a modern, secure, and integrated health information ecosystem that supports a real-time decision-making, safeguards data sovereignty, and reinforces our commitment to evidence-based health policy. Thank you, Mr. Speaker.
Thank you very much. Yes, Dr. Ajimai.
Thank you very much, Minister. I might have mixed it. Forgive me if I did. My question was in threefold: collection, analysis, and dissemination. Dissemination is very key, but in your response, I didn't hear a response on dissemination of this data. Can you please point to the various paragraphs that answers the question on dissemination? Thank you.
Yes, Minister.
Mr. Speaker, if the honorable member will come again, dissemination as in the analysis we get from the data gathering, what we learn from it, and disseminating that information, or what do you exactly mean by dissemination?
Thank you very much. You have collected data, you've analyzed data. How do you disseminate that data to transform into policy evidence or evidence policies that will require in the health sector? Thank you.
Yes, Honorable Minister.
Mr. Speaker, what data does to policy is, Mr. Speaker, I'll give you a practical example, is out of data that we realized that about 43 to 45% of our mortalities in this country are attributable to NCDs, is data. So once you have this data, as a government or as a leader, it informs your policy, hence the establishment of Mahama Cares, to deal with the issues. And so when you know that there is a problem out of the data, maybe in some cases, in some cases, you have to embark on sensitization drive. How you sensitize the people to, maybe if it's for example, if it's an outbreak, if you have a data on outbreak, then you have to roll out your public health strategies to sensitize the people on how they can prevent themselves from that particular outbreak. And so that is how the analysis or the data collection informs decision makers to be able to govern well. I thank you for the opportunity.
Yes, Doc.
Thank you very much, Right Honorable Speaker. I think I will engage further on the response given on the dissemination. I have a quick follow-up. Again, in consonance with BEC's global practices, you realize that research calls are usually announced so that we reduce biasness and other issues that comes with it. The response, however, was lacking on mitigating strategies to reduce biases to research. Can the minister consider such issues that are usually in line with best practices when it comes to research calls? Thank you.
Yes. Is there a question or you?
So, no, it's not an admonishment. The question is, What strategies have they put in place to mitigate research biasness with regards to usually best practices on research course?
Yes, Doc. Honorable Akando.
Yeah, Mr. Speaker, there are various platforms for, if you like, advertising or disseminating the outcomes of research. And for me, every research has a reason. You have a target. If the target at the end of the day is to create some kind of awareness, at the end of the research, you do so, given the aims for the research. But if the research is also to guide you to take certain decisions, you also do accordingly. But that notwithstanding, your issue of best practice is also taken on board. And usually, we use platforms like the Health Summit, the WHO, Health Assembly, and then other avenues or other fora to do this dissemination. Thank you for the opportunity.
Honorable members, let's turn to question 9.5. Question 9.5. And the question stands in the name of Honorable Member for Old Tafo. Oh, you wanted further questions? Okay, then let me give it to Ofolukrum. Dr. Kabiru is speaking a lot. Let me give it to Ofolukrum.
Thank you very much, Mr. Speaker, for this opportunity. Mr. Speaker, I want to ask a question as a follow-up to the answer given by the Honorable Minister. The Minister stated that the data that is captured is very relevant to the health sector. But currently, I'm privy to information that the National Electronic Medical Record System is down. So if the National Electronic Medical System that captures all records of medical issues is down, how are you capturing the data? How are you able to store the data and even access and use that data for the benefit of Ghanaians?
Very well. Honorable Minister. Yes, Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, it is true that we have some challenges with regards to our patients' electronic records. Mr. Speaker, I can assure you that tomorrow I'm going to address the whole country to tell the whole country what we have inherited, what we are going through, and most importantly, the solution. And so I can assure you that it's not going to block or hinder the collection of data at all in any case. It will not. Thank you very much.
Well. So we turn to Dr. Kabilu. Doc, he's your friend though. I'm saying Akando is your friend. Okay, let's hear you.
Mr. Speaker, I am rather difficult because yesterday at a TV program, it was a serious issue on the issue of the contract between the Minister of Health and the Lightwave Health Information Management System. The fact that we are now going back to manual system of collecting data, that after an initiative by the previous government to digitalize our data and to contract to ensuring that we have electronic collection of patients' data for the purposes of coordinating and informing evidence-based health policies, we are now back to that era. And that's the reason why I want the minister to rather take this issue more importantly now, because the members of parliament are here, the representatives of the people are here. And if he's going to organize press conference somewhere to address them, I'm not sure I'll be at the press conference, and I'm not sure how I'm going to tell the people of Wale Wale how the minister is addressing this issue. Mr. Speaker, the fact is that these people have not been paid their money. What measures is the minister putting in place to pay them their money so that they can bring back their service? Mr. Speaker, this is my question to him.
Thank you. Honorable Minister, he's saying this is the biggest platform you can have. So
Mr. Speaker, I agree. I will take up the challenge.
Yes.
So hear me. Mr. Speaker, in 2019, Ghana government signed an agreement with a company called Lightwave. Mr. Speaker, the contract sum was $100 million to connect 950 health facilities in the whole country. And the contract was supposed to expire in 2022. Mr. Speaker, in 2022, the contract was extended twice to expire on the 31st December 2024. Mr. Speaker, at the end of the 2024, out of the 950 facilities, only 450 had been connected. Out of the $100 million, $77 million had been paid. More than 77%. Meanwhile, less than 50% of the job had been done. Mr. Speaker, as part of the contract, it was supposed to be divided into what we call milestones. And so at the end of each milestone, the infrastructure and everything must be handed over to the state. Mr. Speaker, it is unconscionable for any government appointee to sign an electronic agreement that an individual will be hosting our data and the state will not have access to our data and the state will not have access to our service. Our health data. Mr. Speaker, this is what we inherited. Mr. Speaker, at the end of the 2024 when we took office, in 2025, the contract had expired. And so the issue of the government has come to terminate any contract doesn't arise, Mr. Speaker, because the contract actually expired on 31st December 2024. So there was no issue of termination. Mr. Speaker, when we took office, as part of the contract, we said, hand over whatever you have done to the state. And before we sit to take delivery of whatever has been done, we needed as a ministry, as a government, to know whatever we were inheriting. And so a forensic audit was conducted, Mr. Speaker. Mr. Speaker, as part of the forensic audit, what we realized was that the software, the hardware, the infrastructure alone, there were gaps. For example, it was stated in the agreement that supply HP laptops. You go to the facilities and a different brand has been supplied. Supply 20 and you go to the grounds and less than 20 has been supplied. So there were issues of quality and there were issues of quantity. Gaps. Mr. Speaker, the gaps alone, when analyzed, was over $18 million for the hardware. That was the gaps. Mr. Speaker, it will interest you to know that in the next milestone, Ghana government paid more than $10 million to the vendor, and he was supposed to connect about 157 facilities. The Speaker, guess what? Only 7 was verified. 7. 1, 2, 3, 4, 5, 6, 7. Mr. Speaker, after all this, we said that, look, because we don't need any disruptions, we were ready to sign another agreement because there was no agreement, there was no contract. Because of the software, Mr. Speaker, it doesn't also make sense for the country's data, the software, to be owned by an individual. So we are ready. Let's sign a license renewal agreement for 2 years. Mr. Speaker, the vendor indicated that in the agreement, he doesn't want to hear anything about data. Yes. Mr. Speaker, the vendor again indicated that we should write as part of the contract that we, the ministry, have verified 461 instead of 450. Mr. Speaker, there and then, as ministry, we had to put our heads together to find solution to the matter than lamenting. Mr. Speaker, so, honorable members, the good news is that I've shared with you the challenges we have inherited, where the medical records, the electronic medical records, was being hosted by an individual, where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution, and we are rolling out in the whole country. We have a 4-week plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then you switch the thing off. And Mr. Speaker, for your information, the data, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract, and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. And Mr. Speaker, tomorrow, as I've already indicated, we'll give a full presentation on these issues, pictorial evidences, and we'll also tell the people of this country what we are going to roll out. I thank you for the opportunity.
Thank you very much. We turn to question 95. Dr. Kabilo, you didn't own the question. I gave you the opportunity to ask supplementary question. And the question has even revealed some of the information, because you insisted this is the biggest platform, and he alluded to that. So let's move on. Question 95. And the question stands in the name of Honorable Vincent Asefua Oltafo.
Thank you, Mr. Speaker. In accordance with Order 883 of our standing orders, I rise with authority from the Honorable Vincent Eko Asefua, Member of Parliament for Oltafo, to ask the Minister for Health the timeline for the completion of the maternity block at the Tafo Government Hospital. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. I wish to inform this August House that both executive and parliamentary approvals were duly secured for the financing and supply contracts related to the Tafo Maternity Hospital project. Additionally, value for money negotiations were successfully concluded. However, Mr. Speaker, as you may recall, in January 2023, the government, through a circular issued by the Ministry of Finance, suspended payment on external funded projects. As a result, the Dutch Bank AG, the project financier, was compelled to halt the necessary processes required for project effectiveness. Consequently, the project has been temporarily put on hold due to the debt restructuring. I thank you, Mr. Speaker.
Very well. Yes, Honorable Gloria, any supplementary question?
Yes, please. Mr. Speaker, has the Ministry of Health engaged the Ministry of Finance to find a new funding or support to complete the Tafo maternity block and other health projects?
Yes, Honorable Minister.
Mr. Speaker, we are still pursuing the same source of funding, but it has to do with the debt restructuring. And so as and when we sign the bilateral agreements with them or conclude on the restructuring, we think that we've not hit the rock yet to be able to change course. It is due to the debt restructuring, so we are still pursuing the source of funding. Thank you.
Thank you very much. Yes, Honorable Gloria.
Mr. Speaker, what temporary steps has the ministry taken to reduce overcrowding, lack of staff shortage at the Tafo Government Hospital, where the maternity block remains suspended?
Yes, Honorable Minister.
Mr. Speaker, I thought we were talking about construction of maternity. We are now veering into the issues
members, please allow.
Issues of recruitment of workers and what have you.
But he's talking about
overcrowding.
Overcrowding, yes.
Mr. Speaker, what I can assure the honourable member is that we have a program for that facility, and we'll go according to what we have, the program we have. Thank you.
Thank you very much. Yes, Gloria, I'll give you last.
Mr. Speaker, please, I want to find out with the minister that how soon?
Yes, Honorable Minister.
Very soon.
Honorable members. Yes, leader.
Mr. Speaker, with all due respect to the minister, I think the answer he has provided is completely inadequate. Minister, you can do better. So please kindly just respond to the question. But your response,
Minister,
is inadequate.
The leader is your friend. Look at
so, Minister, you know, Mr. Speaker, he's my former friend, so he should be able to.
Speaker, this house is a house of records, and I don't expect my colleagues want me to lie to the house. This project is dependent on the conclusion of the debt restructuring. I must know when the debt restructuring will end before I can tell you when we can even have access to the source of funding. So, Mr. Speaker, we are pursuing it, but with the greatest of respect. I do not want to be called to appear before the Government Assurance Committee, and therefore I am being very careful here.
Thank you very much. Honorable members, this is a constituency-specific question, so we will not rule out any supplementary question to any member. So we turn to question 262. 262. Honorable Member for Suhum, Honorable Frank Asiedu-Bequin.
Thank you, Mr. Speaker, for the opportunity. I will arise to ask the Minister plans the ministry has for the expansion and refurbishment of the emergency ward at the Suhum Government Hospital.
Thank you very much. Honorable Minister, Suhum Government Hospital.
Mr. Speaker, thank you for the question. The ministry fully acknowledges the essential need for a well-functioning and adequately equipped emergency ward at Suhum Government Hospital. At present, the expansion and refurbishment of the emergency ward has not been captured under the 2025 fiscal year budget. However, the ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion in the capital expenditure program in the near future. Mr. Speaker, I wish to assure this August House that the ministry will prioritize this intervention to strengthen emergency healthcare services for the people of Suhum and its surrounding communities. Thank you.
Your choice of words, in the near future. Meanwhile, 2026 budget is coming. Why don't you say 2026 budget? Anyway, honorable member for Suhum.
Mr. Speaker, nobody should think that that facility belongs to only Suhum people. Because if you travel from Accra to Kumasi, you pass through Suhum. Those from Akosombo, Koforidua, going to Winneba, Cape Coast, they pass through Suhum. So, between January 2025 and September, we've had 263 reported accident cases in Suhum. So I want the minister to assure us if he's going to fast track his assessment of the situation in Suhum, because the Suhum government hospital serves a lot of people, including people who live outside Suhum. Can the minister assure us of some assistance?
Yes, Honorable Minister. He has given the importance of Suhum Hospital.
Thank you, Mr. Speaker. Mr. Speaker, I wish to reiterate some aspect of my response. And I quote, the ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion. So, Mr. Speaker, I think what the honorable member needs to do is to work with the ministry so that we can assess the situation and see what we can do. Thank you.
Very well. Honorable Asidbe Queen, at times it's better to one-on-one deal with the minister. So work with him. So let me take your last question.
I hope to state that in trying to collaborate with you, I should meet you in the office. Currently, if there are accident cases, you go and you find patients lying on the floor. Can the minister come in with some temporary measures to ameliorate the situation in Suhum?
Yes, Honorable Minister.
Mr. Speaker, I fully agree with the honorable member that the Suhum Government Hospital is at a very strategic position that serves anybody who plies on the road. And so, as I have already indicated, you should work closely with my office, and I can assure him that we are in to serve the country. We will do our best. Thank you.
Thank you very, very much. Honorable members, we will turn to question 263. 263. Honorable member for New Joabe North, Honorable Nana Osei Eje.
Mr. Speaker, I stand on Order 883 with the express authority of Honorable Nana Osei Eje, and with your permission, to ask the Minister for Health the status of the Eastern Regional Hospital, which has been abandoned after 70% completion.
Yes, Honorable Akando, Minister. The way you are smiling, it means we are going to give a straight.
Mr. Speaker, the design, construction, and equipment of the Eastern Regional Hospital was awarded in May 2020, 5 years ago. The project made progress to attain a completion of about 57%. However, the project stalled due to the debt restructuring. Mr. Speaker, as indicated earlier, the Ministry of Health, in collaboration with the Ministry of Finance, will consider resuming once the processes for the debt restructuring is concluded. So, Mr. Speaker, if the project was abandoned, it was abandoned long ago, but we will go back to site and do the needful. Thank you.
The way you were smiling, I thought you were coming to give different response. Yes, honorable member for Forukrum.
Mr. Speaker, no further questions.
Very well, thank you. So, honorable members, we turn to question 326. Honorable Dr. Thomas Winsome Anaba, a member for Garu. Doc, you have the floor now.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the measures the ministry is taking to complete the Garu District Hospital.
Honorable Minister, Garu Hospital.
Mr. Speaker, I wish...
Honorable Member, may you put off your mic? Very well.
Mr. Speaker, I wish to inform this Honorable House that the Garu District Hospital project in the Upper East region forms part of the Agenda 111 initiative. The project had achieved an overall physical progress of 63% as of December 2024. Following government decision to rationalize the implementation framework of the Agenda 111 program, the Ministry of Finance, by a letter dated 13 February 2025, formally advised the Ministry of Health to incorporate all Agenda 111 projects into its annual budget proposal from 2025 onwards. Subsequently, His Excellency the President, through a directive dated 20th February 2025, instructed that the oversight and implementation of the Agenda 111 project be formally transferred to the Ministry of Health. In line with this directive, Government commissioned an audit of all ongoing Agenda 111 sites, which is currently being undertaken by Measures Architectural and Engineering Services Limited, AESL. The Ministry is presently awaiting the submission of AESL's final report and accompanying recommendations to inform the next course of action towards the continuation and completion of the Garu District Hospital project. Thank you.
Yes, Dr. Naba, any further questions?
Mr. Speaker, thank you very much. Let me thank the Minister for his answer, but I would like to explain that the Garu District Hospital is very necessary to be completed simply because Garu has never had a district hospital. We used to patronize the Boku Hospital, but due to the conflict and crisis in Boku, we no longer have a hospital where we go to get sick health. That is why the government decided to put up the Garu District Hospital. And as it is told, most of the staff who were in the Boku Hospital have been moved to either Zebila, Binduri, Garu, or Timpani. But if you check around the Kosak area, out of the 6 districts, none of them has a district hospital. So we think that completing the Garu Hospital is very imperative to ensure that at least it caters for the other district or even help reduce the burden and pressure on the Boku Hospital if it resumes work. So I would like to plead with the Minister to ensure that when they are considering hospitals to be completed, at least the Garu District Hospital should be part of those few hospitals. Thank you.
Thank you very much. This is not a question. So, Dr. Kabil, this is a constituency. This is not your constituency.
Mr. Speaker, the response from the Minister goes beyond the specific constituency. And if the response of the Minister is far and wide, it's only well and good that we are allowed to ask questions.
Let's hear you. Let's hear you.
Minister. Mr. Speaker, I would think that Garu was one of the many districts without hospitals. And Nana Addo Dankwa Akufo-Addo vision to make sure that every district, and he mentioned that none of the districts in that particular enclave has a district hospital, but through the Agenda 111, all of them would have had district hospital. Mr. Speaker, the problem with Garu, I know Garu personally, and I know the specific hospital. Mr. Speaker, in fact, of all the hospitals in the Upper East region, Garu District Hospital is one of the hospitals that have gotten at least considerable percentage of work done. The work done on that particular hospital means that...
Doc, just ask the question. Just ask the question.
Mr. Speaker, I want to find out from the Minister if this so-called audit, that this so-called audit, that is to be done on the Agenda 111. You can wait for your statement to be made. Mr. Speaker, I'm being harassed. I will need your protection. Mr. Speaker, I want to find out from the minister. Public accounts is way to go and do your work. Mr. Speaker, I want to find out from the minister this so-called auditing by the auditor or forensic audit, whatever he terms it, on this particular agenda 111. What is the goal of that auditing, and how soon are we going to get the audit being done? What's the goal? Because work is being done.
Honorable Kabilu, respectfully, you are changing the question entirely. I hate to do that, but if you are asking question directly to Garu, fine. But now you are shifting to auditing and those kind of things.
Mr. Speaker, he mentioned in his response that they have engaged an auditing firm to do an audit of the projects. Agenda 111 project. I didn't introduce that, Mr. Speaker.
Honorable Minister, so he said, what's the intent of the audit? If you can tell us something.
Mr. Speaker, you take office and you have ongoing projects. You need to understand where the contractors have gotten to, how much has been paid, especially so when you don't have a dedicated source of funding for the project. And then as government, you strategize to see how you can get money to continue all these projects. So, Mr. Speaker, you must understand what you have inherited. That will inform your strategy for securing funding for the project. Mr. Speaker, let me assure this House that His Excellency the President has indicated time and again that he is not going to abandon any project he has inherited, ongoing project that he has inherited. And therefore, I can assure the House that we will tackle any project that we have inherited in due course. Thank you.
Thank you very much. We turn to question 492. Question, Dr. Anaba.
Mr. Speaker, thank you very much. Once this is a House of Records, I want to correct misinformation. Garu had a project from the NDC government in 2012 by NMS to build a hospital.
Honorable Doctor.
So to say that Garu never had a hospital, there was a project ongoing. Your government came and stalled it and put it in the infrastructure tracker that you are building a hospital in Garu, which was not true.
Honorable Dr. Anaba, respectfully.
Thank you.
Respectfully. Leader.
Actually, I was outside when I heard the follow-up question about Garu. I rushed in because I thought that there was some misrepresentation that needed to be corrected. And I think that is what the member for Garu is trying to do. The questionnaire actually mentioned Garu as a beneficiary of Agenda 111. But that's not the case. The Garu Hospital was started by the NDC 9 years ago, or even more. And then when the NPP took over, they stopped the project. So for 8 years, nothing happened there. Materials that were mobilized at site were all vandalized and stolen until NDC has come back. And so that is why he's asking the minister what is going to be done to complete that hospital, whether it will be prioritized. So when you do a follow-up question and then you present it as if Garu was a beneficiary of Agenda 111, I think that the record needs to be corrected. That Garu was not a beneficiary of Agenda 111. Boku was not a beneficiary of Agenda 111. I have not seen Agenda 111 in Pusga. I have not seen one. I only know that because the NPP won Binduri constituency, that is the only place that was assigned an Agenda 111 hospital.
Leader.
The rest didn't get any Agenda 111 hospital.
Leader. Leader. I think
Mr. Speaker, Mr. Speaker, Mr. Speaker, I think the majority leader didn't get the right briefing, because if you look at page 7, response from the minister on the question 326, the minister admitted that it is an Agenda 111 project. But that's what the answer. The minister said. The minister said, Mr. Speaker, I wish to inform this honourable House that the Garu District Hospital project in the Upper East region form part of the government flagship Agenda 111 initiative.
And he himself admitted. He himself said it's Agenda.
Honourable members, please.
10 kilometers. No, what be benefiting from big push? No, they suspend. They big push. No, yes, they be in starting when they
whose microphone is on, please?
Okay, so Mr. Speaker, if the NPP government decided to adopt that project, please, let's listen to each other. Please, let's listen to each other. The minister is sitting here. I know the hospital. The member of parliament is sitting here. He knows the hospital. And the minister's records will show that this is a hospital project that was started under the NDC. It was stopped by the NPP. Then after COVID, when MPP decided to do Agenda 111, they may have added Garu, but nothing was done there. Nothing was done there. I'm saying that you took all Agenda 111 hospitals. When the president announced Agenda 111 hospitals, they were supposed to be new hospitals to be constructed. We all listened to him during the COVID when he announced it, that the government was going to construct new hospitals from the scratch. When you decided to adopt the hospital at Garu, then you had moved from your original objective and the Agenda 111. And I'm saying that I would have been happy if after adopting it, you had actually completed the hospital. But even after adopting it, you failed to complete the adopted hospital.
Leader, thank you. But I think if there's any confusion, probably it might have emanated from the minister's response that it was part of the Agenda 111 hospital. So,
Mr. Speaker, you see, don't be too diplomatic with the majority leader. You see,
am I being diplomatic to him?
You are being too diplomatic with the majority leader. The minister is seated there. Mr. Speaker, before even the majority leader walked in here, the questioner had admitted that apart from Garu, all others had district hospitals. By then, the majority leader wasn't here. And if you look at the question, Mr. Speaker, the minister admitted clearly that this is an Agenda 111 hospital. But unfortunately, minister, for some reasons, decided to allow the majority leader to consume him. He said, you don't do this. You don't do that, Mr. Minister. You are in charge. The ministry is in your hands. It is just the chamber that is in the hands of the majority leader. Don't let him bully you. This is an Agenda 111 hospital.
Thank you,
Mr. Speaker. 63% of the project is done. 63. You have admitted. No, I'm not debating. I don't want, you see, you are my friend. I don't want the majority leader to consume you.
Thank you.
Don't allow yourself.
Thank you, Honorable
Let the
Martin.
records reflect that it is an Agenda 111 hospital.
Thank you very much.
It is not. Thank you, Right Honorable Speaker.
Honorable, thank you very much. We will now turn to question 492. Question 492 from Garu. Let's come down to Ejuso. Honorable Member for Ejuso, Honorable Kwabrabo Ating.
Thank you, Mr. Speaker. Mr. Speaker, respectfully, I'm on my feet to ask the Minister for Health whether there's any plan on paper by government to establish a nursing training college in the Ejuso municipality. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I thank the Honourable Member for the question. The Ministry of Health recognizes the importance of expanding training opportunities to meet the increasing demand for skilled nurses and midwives. However, at present, there is no official plan or approved documentation for the establishment of a nursing and midwifery training college in the Ejuso municipality. Mr. Speaker, the Ministry currently oversees 94 nursing and midwifery training colleges across the country, 14 of which are located in the Ashanti region. Before any institution is established, the Ministry, through the Human Resource for the Development Directorate, conduct a comprehensive needs assessment and feasibility study. These assessments take into account regional equity, availability of clinical training sites, financial and staffing considerations, and the accreditation requirement of the Nursing and Midwifery Council and the Ghana Tertiary Education Commission. Mr. Speaker, while the Ministry has received expression of interest from the stakeholders within the Ejuso municipality, no formal proposal has yet been submitted or approved through the Ministry's internal processes. That said, the Ministry remains open to collaboration with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions in underserved areas as the need arises, particularly for post-basic and specialist training programs. Thank you.
Yes, Honorable Kwabrabo Ating.
Mr. Speaker, thank
Any
you.
further?
Yes, Mr. Speaker, by way of laying basis for my next question, I would like to say that the Ejuso municipality is a youthful population. The size is about 74,000. Mr. Speaker, we have about 8 senior high schools churning out graduates, of which some of them may want to pursue a career in nursing. The municipality is also an urban one, hosting about 46 major towns. 2024 projection, population projection is about 196,000. Mr. Speaker, I would want to find out from the minister if these are not necessary imperatives which may warrant, Mr. Speaker, an establishment of a nursing training in the municipality, looking at, Mr. Speaker, the indices that I have enumerated. Thank you.
Minister, have you heard the imperatives? Very, very necessary ones.
Mr. Speaker, all the factors he has enumerated are all very necessary requirements. Thank you.
Minister, I didn't get your answer well. Yes.
Mr. Speaker, the questioner only asked, yes, the questioner only asked whether or not the factors he has enumerated are not necessary imperative for the establishment of a nursing training college. Is that not my question?
Yes.
Is that not the question I'm supposed to answer? I say yes, they are.
So you are going to give establish one?
Mr. Speaker, are you asking the question for him? There was a very simple question I'm supposed to respond to.
Yes.
He didn't add that. Did he? He didn't add that. So, Mr. Speaker, I will read some portions of my response. I'll repeat them. That the ministry remains open to collaborate with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions, especially in underserved communities. So, Mr. Speaker, we can take it from there. We will link up, and then we will take the conversation from there.
Thank you. Yes, Honorable, do you still wish to?
Yes, Mr. Speaker, my last question may be, and Mr. Speaker, permit me to lay the basis. I'm rightly informed that papers have been sent to the ministry, as the minister also rightly indicated that there's been some proposals. Mr. Speaker, I may want to know that if a formal proposal, one which the minister will rightly deem, befitting a proposal, how long will it take for steps to be taken to consider setting up a nursing training in the municipality?
Honorable Member, you see, at times we have to. In this house, at times it's better to see the minister one on one. You've laid the basis. I will ask you to deal with the minister personally. That may yield the needed results. So after laying the basis, I will urge you to try to see the minister and discuss the matter over him.
Very well, Mr. Speaker, I take a cue.
Very well. So, honorable members, let's take the last question. Let's take the last question from Honorable Member for Hemain Lower Denchura, Honorable Lawrence Ajinsam. Honorable Member, you take the last slot.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the plans of the ministry to furnish the Chufu Hemain Lower Denchura District Health Directorate with an administration block and staff bungalows to operate effectively and efficiently. Thank you.
Thank you very much, Honorable Minister.
Mr. Speaker, the ministry acknowledges the importance of providing a conducive working environment and adequate residential accommodation to enhance the effective and efficient operations of the Chufu Hemain Lower Denchura District Health Directorate. As part of the ongoing health sector reforms, the construction of office and auxiliary facilities at the district level has been decentralized and now falls under the purview of the respective district assemblies. The ministry will, however, collaborate closely with the Ministry of Local Government, Chieftaincy and Religious Affairs, as well as the district assembly, to ensure that appropriate office and residential accommodation are provided to facilitate the effective performance of health staff within the district.
Yes, Honorable Ajinsani, any further questions?
Thank you, Mr. Speaker. Mr. Speaker, I would want to do a follow-up by asking the Minister, per his answer, that the construction of office and ancillary facilities has been decentralized. When was it decentralized? And then what are the steps that I need to take to be able to engage the district assembly so that Chufu Hemain Lower Denchura would have the needed office?
Yes, Honorable Minister. Honorable Sunyani Bruni, Sunyani JJ, may you put off here? Yes.
Mr. Speaker, as far as I can recall, for the past 8 to 9 years, the Ministry of Health has not constructed district health directorate offices in the country. It has always been part of the project by the district assemblies. So when they do the constructions, then we will fill in the staff. Thank you.
Yes, Honorable.
My last question. If indeed the minister says that it has to be done by the District Assembly, my follow-up question is, what about logistics, computers, and other things that need to be provided to the Health Directorate? Is it also to be provided by the assemblies or by the ministries?
Yes, Honorable Minister.
Mr. Speaker, as the Directorate for under the ministry, as and when they need the assistance, they have the right to write to the ministry or the Director General of Ghana Health Service, and we will look at it and consider it accordingly.
Thank you very much. Honorable members, on behalf of the House, let me thank the Minister for attending upon the House to respond to members on issues relating to health in their constituencies. Honorable Minister, we thank you and you are hereby discharged. Leadership. We are on statement.
Mr. Speaker, I think we have 2 statements.
I only have one.
Yeah, we can do one and then.
I only have one, and that statement, on Friday, I decided to take the statement today. That is in respect of Ghana cedi assisting. I think today the Bank of Ghana celebrated and launched it. So I think it will be appropriate. I asked the chairman of the Committee on Economy and Development to read his statement in respect of Ghana cedi assisting. So, Honorable Afo, you may take the floor now.
Right Honorable Speaker, let me thank you so much for the opportunity to read this statement to commemorate the 60 years of our Ghana cedi since its introduction in Ghana. Mr. Speaker, the cedi continues to be durable, portable, divisible, uniform, limited in supply, and generally accepted in Ghana. Mr. Speaker, the cedi continues to function as a medium of exchange of goods and services, also serves as a store of value, allowing people to save wealth over time. It also functions as a unit of accounts and values. This enables us to compare the worth of different items. Mr. Speaker, let me use this opportunity to commend the government and the governor of the Bank of Ghana and his team for the effort to end dollarization, i.e. the practice of pricing goods and services in US dollars instead of Ghana cedis in Ghana. That has a tendency to depreciate the Ghana cedi through the increase in demand for the US dollar. To be specific, the government has issued a directive requiring all government contracts to be denominated in Ghana cedis rather than in hard currencies such as US dollar. Moreover, the governor of the Bank of Ghana, Dr. Johnson Isiama, strengthened this measure by mandating all goods and services to be priced solely in Ghana cedis. All these measures have contributed to making the cedi one of the strongest performing currencies in the world. Evidenced by its continuous appreciation from 17 cedis to $1 in December 2024, to a current range of 10 cedis 30 pesos to 12 cedis to $1. Mr. Speaker, the Ghana city has undergone a remarkable transformation since the country gained independence, reflecting the nation's political, economic, and social changes over time. Its evolution tells the story of Ghana's journey towards the economic sovereignty and stability in the face of both internal and global financial challenges. Before independence, in 1957, the Gold Coast, now Ghana, used the British West African pound, sterling, and penny, which were issued by the West African Currency Board. These colonial-era currencies served several West African territories under British rule. However, after achieving independence, Ghana sought to establish its own monetary identity as part of its broader global, national, and economic independence. Mr. Speaker, in 1958, Ghana introduced its first national currency, Ghana Pound, which was equivalent in value to the British pound sterling. The establishment of the Bank of Ghana in 1957 played a vital role in managing this new currency. The introduction of the Ghana Pound symbolized the country's first step towards economic self-determination and control over its monetary policy. A few years later, in 1965, the first cedi was introduced by Dr. Kwame Nkrumah, replacing the Ghana Pound. This change marked Ghana's move from the old imperial monetary system to a decimalized one, which one cedi was equal to 10 shillings or 100 pesos. The term cedi originates from the local word cedi, meaning cowrie shell, which had been used as a traditional form of money in pre-colonial times. The introduction of the cedi represented not only modernization but also reclaiming of Ghana's cultural identity in its currency. Mr. Speaker, however, political changes soon influenced Ghana's currency system. After the overthrow of Dr. Kwame Nkrumah in 1966, the new military regime replaced the existing cedi in 1967 with a new cedi, partly to remove symbols associated with the former president. The new currency had a conversion rate of 1 new cedi to 1 cedi 20 pesos old cedis. While this change was politically motivated, it was demonstrated the close link between politics and monetary reform in Ghana's history. Mr. Speaker, throughout the 1970s and 80s, Ghana's economy experienced several instability, high inflation, frequent devaluation, and the emergence of black market exchange rates eroded confidence in the cedi. During this period, the government implemented several exchange controls and economic reforms. The situation worsened until the Economic Recovery Program, ERP, was launched in 1983, and the leadership of Flight Lieutenant Jerry John Rawlings, which aimed to stabilize the economy and restore confidence in the financial system. Mr. Speaker, by the early 2000s, the cedi has suffered significant depreciation due to persistent inflation, making financial transactions cumbersome. For instance, it took around 10,000 old Ghana cedis to equal $1. To address this problem, the Bank of Ghana redenominated the cedi in July 2007, introducing a new currency known as Ghana cedi. The conversion rate was 10,000 old Ghana cedis to 1 Ghana cedi. This redenomination simplified transactions, improved efficiency in accounting and pricing, and sought to restore public confidence in the currency. In recent years, the cedi has continued to evolve alongside Ghana's modern financial landscape. The Bank of Ghana introduced enhanced security features and new high-value denominations, that 100 Ghana cedis and 200 Ghana cedis in 2019 to facilitate larger transactions. Meanwhile, the growth of the digital payment systems, including mobile money, has significantly transformed how Ghanaians interact with their currency. Despite this advancement, the cedi continues to face challenges such as depreciation against major foreign currencies, inflation, and global economic shocks. Let's all Ghanaians work towards the Ghana cedi to become an enviable currency in the world, as the journey has started from the beginning of 2025 fiscal year, as the cedi is trading with other hard currencies positively. This is a good sign of a strong currency in a strong economy. In conclusion, the history of Ghana cedi is deeply intertwined with the nation's political and economic journey, from the colonial era British pound to the modern Ghana cedi. Each transformation has reflected Ghana's desire for stability, identity, and growth. While the cedi has faced many challenges over the decades, it remains a powerful symbol of Ghana's resilience and commitment to economic independence. Thank you, Mr. Speaker, for this opportunity. Thank you.
Thank you very much. He said what? Oh, no, not 1-1. This is a very important statement. And I think we can, together with the leadership, we can give 3-3. So let me start with Honorable Member for Manson Kwanta. Please, you wouldn't contribute more than 3 minutes.
3 minutes, all right. Thank you, Mr. Speaker. Firstly, I commend the maker of the statement, who happens to be the chairman of the Committee for Economy and Development, where I serve as the deputy ranking. Mr. Speaker, we congratulate ourselves as a country for having our own currency for 6 decades. Having our own currency, Mr. Speaker, serves to give us economic independence, having moved away from the British pound following independence. Mr. Speaker, having our own currency, the cedi, has also given us the freedom to be able to set our own monetary policy, which controls inflation, which controls interest rate, etc., without relying on any foreign sovereign to do this for us. Mr. Speaker, having our own currency, the cedi, for 60 years has also given us the flexibility in terms of trade, in terms of taxation, and also in terms of budgeting. We control our own currency. There is also the integration into the global financial system. We have our own currency, which the world has recognized. The world trades with it. It is accepted across the world. This is a source of pride to us as a nation, and is including us in the world platform for trading. Mr. Speaker, the cedi has shown resilience. As the maker of the statement indicated, we have seen the cedi, the notes being replaced, coins being replaced. We've seen the cedi being redenominated to make it easier to carry and transact, etc. The cedi has seen calm, the cedi has seen turbulence, but the cedi continues to thrive, and it is our source of pride. Mr. Speaker, with these few words, I will commend the maker of the statement, and I say I wish the cedi long live and happy 60 years anniversary. I thank you very much.
Thank you very much. Let me invite the Minister for Education.
Mr. Speaker, let me thank you to contribute to the statement ably made by the Honorable Afo in joining the country to celebrate 60 years of the cedi And Mr. Speaker, in the words of the Governor of the Bank of Ghana at the ceremony today, he stated under the theme 60 years of the city, a symbol of sovereignty, stability, and economic resilience. Mr. Speaker, in commending him, he has brought an important matter to the fore. The Bank of Ghana, the Bankers Bank, the lender of last resort, responsible for maintaining and monitoring financial stability and price stability. First, this is Parliament. What is the relationship between Parliament and the Bank of Ghana? Mr. Speaker, we are yearning for an independent, autonomous Bank of Ghana, where monetary policy is the determination of the Bank of Ghana and fiscal policy will rest in the Minister for Finance. But Mr. Speaker, the relationship, sometimes monetary policy suffers when you don't manage your fiscal policy well. But as the maker of the statement rightly observed, echoed by the governor himself and our colleague who just spoke, the cedi today is celebrated as one of the best performing currencies in sub-Saharan Africa, at least in the last 8 months. The cedi has appreciated, Mr. Speaker, according to the Governor of the Bank of Ghana, by 37.4% year on to date, October 17, 2025. Mr. Speaker, again, we are told that headline inflation has dropped sharply to 9.4% as of September 2025. Then, Mr. Speaker, our observation. In 2022, the cedi depreciated by over 50%, becoming the world's worst performing currency, according to Bloomberg, and the headline inflation spiraled to 54.4%. Food inflation soared to 59.7%. But Mr. Speaker, this is the difficulty to manage. So one of the fundamental problems of the John Mahama administration is that you inherited an economy which was damaged in terms of the standing of debt. That's why you had to undergo a debt exchange program. And apart from that, inflation unacceptably high. But for me, Mr. Speaker, as he makes the statement, this parliament must support the Bank of Ghana in its regulatory role. That is why they are accountable to the Parliament of Ghana. Indeed, Mr. Speaker, they are expected even to give us a quarterly or post-quarterly report. The Bank of Ghana has a responsibility to report to the Parliament of Ghana on its operations over the years. Mr. Speaker, we should also celebrate the Bank of Ghana, at least if for nothing, Mr. Speaker. Last week I was in Sunyani at the University, UNER, the University for Energy. And the hall I sat in, the Vice Chancellor came to me and said that this has been constructed by the Bank of Ghana as part of its corporate social responsibility. I'm told if you go to the University of Ghana and you look at the city hall, thanks to the late Emisata, then when he was governor of Bank of Ghana, you have a beautiful edifice of a lecture hall, which was also constructed by the Bank of Ghana. Mr. Speaker, today the Bank of Ghana has a hospital which is open to the Ghanaian public. But we want them to concentrate on their core responsibility as the bankers' bank and the regulator of the bank. We saw how government had to spend, Mr. Speaker, in the past, over 23 billion with what is popularly referred to in Ghana as a collapse bank, or what's the name you called it, what the Honorable Kenoforiata. So we pay tribute, Mr. Speaker, in celebrating now Governor of the Bank of Ghana, Johnson Esiama, his deputy Zakaria Mumuni and Matilda Asante. We wish them well, but they should also recognize that others came before them and they played their part. Whether it was Governor Addison or it was Governor Paul, they all did their best. But we think that we should reposition the Bank of Ghana to take its place. Modern central banking, what is the interest rate, policy rate? How is it determined in Ghana? How is that affecting the Ghanaian private sector? And how are they able to make meaningful contribution to it? Mr. Speaker, President Mahama made a promise to the Ghanaian people to establish a women's bank. Let me assure our colleagues that he would honor that promise, and a women's bank will be established. A women's bank will be established as part of President Mahama's effort to empower women and to expand access to credit by them. But, Mr. Speaker, my advice is to all of us and to Ghanaians, the way we handle the Ghanaian city, all of us in our pockets, you love it, and then the way we treat it in our pockets, we don't do the same thing to the British pound, we don't do the same thing to the dollar, but when you get the cedi, then you squeeze it as if it's some valueless paper, yet it's a paper that you expect to use for the purchase of your goods and services. So the Bank of Ghana must also deepen public education on the way we relate to the Ghana cedi. So, Mr. Speaker, we have every reason to celebrate the cedi at 60, but in celebrating it, as I used to observe, the cedi suffered too much epilepsy in the face of the pound sterling, in the face of the dollar, which reduced the value of and the weight of the cedi.
Minister, I think
I don't provoke debate, Mr. Speaker. So I want to commend the maker of the statement, congratulate and commend the leadership of the Bank of Ghana, past governors of the Bank of Ghana, past chair of the Bank of Ghana, and then to Parliament. Mr. Speaker, the late Anthony Akotosai of blessed memory, there is no day I will comment on Bank of Ghana without recognizing, even when we had to review the Bank of Ghana Act as to whether the Bank of Ghana can finance government or not. Part of the crisis we are in as a country, what we witnessed in 2022, was the Bank of Ghana financing government. That's what resulted in now the debt exchange and the slippage of the economy. The Honorable Antonio Akoto is sitting here every other time, cautioning us that the Bank of Ghana, and he was a strong advocate of zero financing of government by the Bank of Ghana. I pray that we will keep faith to it. Now, gold reserves, Mr. Speaker, we have to. Everywhere in the world, gold reserve. We should learn from best practice and allow for efficiency in improving the standing of our gold reserve. So, Honorable Afo, I commend you and I thank you for the statement. Mr. Speaker, thank you for tolerating.
Thank you very much. But Ranking, are you not speaking? So leadership, because I said 3 including leadership. I said 3 including leadership. Okay, Dr. Kabiru.
Mr. Speaker, thank you very much. Let me join my colleagues in commending Honorable Eric Afo for making this statement on the back of the 60th anniversary of the Ghanaian cedi. Mr. Speaker, I don't need to go back to the history of the Ghanaian cedi, as there are many gray hair here who understand this better than I do. And then the make of the statement also attempts to capture that particular history. Mr. Speaker, the fact is that after 60 years, the Ghanaian cedi has not found its feet. And I would think that in this moment of reflection, we will need to ask ourselves why, that after 60 years, our cedi is still trying to find its feet against the major trading currency. We understand our currency is not a vehicle currency, but we do also appreciate that for your economy to be very strong, you will need to have your cedi or your medium of exchange or your currency very stable. For predictability of businesses, you need to have it very stable for the, for the health of the economy and even for the purchasing power of the ordinary person. So we all agree and we all admit that we must do something strong about the performance of our city. Mr. Speaker, as we celebrate these 60 years, we have to pay some glory tribute to some other individuals. He mentioned some names. And I think it's important that we cannot celebrate 60 years of independence and the history of the currency is being talked about without reference to Dr. Mahmoud Bawumia. When His Excellency Dr. Mahmoud Bawumia was at the Bank of Ghana, he was the arrowhead of the redenomination exercise that brought some stability into the Ghanaian city. This is a fact of, a statement of fact, and we need to pay growing tribute to him. Mr. Speaker, we equally need to appreciate my senior brother and respected leader of the House, former leader of the House, and also the minister responsible for education, has brought our attention to the need for us to support our currency with commodities such as gold. And that international, the African Development Bank, and even international communities are now coming to the realization that you will need to support your currency with a very predictable commodity, i.e. gold. And the Vice President, when he came out with this idea, people say it was not novel. People were mocking at him. Mr. Speaker, the chicken has come home to roost. And I'm happy that the governor of the Bank of Ghana can now go on international platforms to count the success of the country on the back of gold reserve program and gold purchase program. And I'm happy that we are building a country, and the contribution of Dr. Mahmoud Bawumia need to be highlighted. Mr. Speaker, what can we do? Currently, the performance of the CD is because we are giving the CD aphrodisia. So much, we are giving the CD, the performance of the CD is because it's being given an aphrodisia, Mr. Speaker. And if your CD is performing because it's given an aphrodisia, Mr. Speaker, you don't call that natural performance. You don't term that natural performance. Mr. Speaker, we need our CD to perform naturally. We need our city to perform naturally. And how do we do that? We will need to improve on the real sector of the economy. That's the only way, Mr. Speaker. Otherwise, all the performance we are seeing about the city, it is not based on productivity. We are learning. The Bank of Ghana is pumping some over 1.3 billion this month alone to support the city. I mean, this is not economic management. This is actually intensive care management of the city. That is an intensive care management of the city. And I don't think that that is the way we need to go with the money of the city. As we celebrate 60 years, Mr. Speaker, we want to also advise that there's need for us to streamline the black market rates with the formal rates. Mr. Speaker, I don't understand why Abochi will be charging us 13 Ghana cedi to the dollar, and the Bank of Ghana is quoting 11 Ghana cedi to the dollar. It doesn't make sense. There must be some symmetry. There must be some consistency. The differences should not be done. Mr. Speaker, I'll conclude on this note. The maker of the statement is referring to some exchange rate that was 17 to the dollar. Mr. Speaker, and I'll come on the ruling of this particular House. The House has ruled in January 26, 2017, and it is based on evidence to support a statement of fact. Mr. Speaker, the issue that was at time, whether or not a member can continue to speak when challenged on a statement of fact. Mr. Speaker, there's a statement of fact that has been mentioned that the cedi was changing to the dollar for some $17 Ghana cedi to the dollar. Mr. Speaker, I think based on the ruling of this House, we have to expunge that from the statement. Because the ruling of this House is clear on such matter that where a member of the Honorable House is challenged on a purported statement of facts, the member must support the statement with evidence or withdraw the unsubstantiated statement. Mr. Speaker, this was the ruling of the House on the 26th of January 2017. So I want to... 2017, the ruling of this Honorable House. So, Mr. Speaker, I want to urge my colleague that this part of the statement should be expunged from the records, or he provides the evidence to substantiate that. Since he does not provide evidence on the statement, prima facie, that statement should not be part of the records of this House. With this view, Mr. Speaker, I thank you very much, and we wish the city well.
Very well. Yes, let me give the Deputy Minister the opportunity.
Thank you, Mr. Speaker, for the opportunity. I want to start by congratulating the whole of Ghana for the celebration of the cedi at 60. And the cedi, which came into being in 1965, is 60 years now, and it's going to be a year-long celebration. And believe you me, it has gone through various reforms, and we are still using the cedi. And as we speak now, in the tenure of His Excellency John Dramani Mahama, we all see how the cedi is performing now against the dollar. We recall in 2024 where the cedi was performing very badly against the dollar. And so you see clearly that this is an administration that wants the cedi to, Ghanaians should see the value of the cedi as we celebrate the cedi at 60. And so, Mr. Speaker, I would want to join the Bank of Ghana, the governor and his team for this year-long celebration, and I believe that the cedi is going to perform better even as the days roll by, as the years roll by. Congratulations to Ghana, congratulations to all of us. Thank you, Mr. Speaker, for the opportunity.
Yes. Honorable Oponkroma.
Mr. Speaker, thank you for the opportunity to contribute to this statement. And I want to commend the chairman of the Committee on the Economy and Development for this commemorative statement. Mr. Speaker, as we celebrate 60 years of the Ghana cedi, to many Ghanaians, the most important question is, what's the value of the cedi? What can it really buy? And that brings to mind two specific questions: the question of inflation targeting and inflation management, and our exchange rate. Mr. Speaker, if you study the economic history of our country, our cedi performs very well at some points in time and also very poorly at some point in time. Whenever a government has access to large volumes of forex reserves to do what they call market intervention, the cedi is able to stand its ground against international currencies. And whenever we run short of hard currency, the depreciation gets very dire. Today, I'm happy to reiterate the comments made by the Minister for Education that the governor announces about a 37.4% appreciation of the cedi year to date. The question is, how? And I think the government has answered it already by explaining that it's because they are doing market intervention. In fact, this month alone, as was mentioned by one of my colleagues, the Bank of Ghana is dumping about $1.3 billion onto the market. That is the reason for the appreciation. So where are they getting these dollars from? Mr. Speaker, it's because in 2021, a gold purchase program was introduced for the first time in our history, aimed at enabling the state to, through the Bank of Ghana and the PMMC, buy gold and increase our gold reserves. That's how come we moved from 8 tons to 30 tons. Mr. Speaker, at that time, gold prices were averaging about $1,700 per ounce. Today, gold prices are averaging about $4,000 per ounce. And so because of this gold purchase program, we are able to mobilize a lot of forex. And the central bank is now doing a lot of market intervention with the forex. Has anything strange happened? No. It is because of the conditions of the market and the introduction of the gold purchase program that today we are able to mobilize a lot of forex through the Bank of Ghana and the Gold Board, which used to be the PMMC, as was the case before. And this forex is now being dumped on the market. So, Mr. Speaker, I beg the question that if you leave the market to the normal forces of demand and supply for currency without a market intervention, will we be getting a 37.4% appreciation? Respectfully, I doubt. And Mr. Speaker, that then raises the second question of what framework is being used today that we are getting windfall? Are we dumping all the windfall on the market to suppress the real rate? It will be recalled that earlier, when the governor and the president denied it, and the IMF cautioned the government to pause and put in place a framework, and they did, the currency started depreciating again. And indeed, the president at the press conference admitted that it was because the Bank of Ghana had stopped the market intervention. So, Mr. Speaker, we don't need to split hairs about it. Today, as we commemorate 60 years of the cedi, we need to be honest with ourselves that it is the market intervention, and any government that is able to benefit from these prices on the market and has these reserves will intervene. It is like somebody with a blood pressure problem who is taking blood pressure medication to bring his BP down, now claiming all of a sudden that his BP is sorted. The day you stop taking the medication, that's when you see your smoothness level. Mr. Speaker, what we need to do is to have a discussion about the sustainability. So how are we going to ensure that on a sustainable basis, the normal market forces, without the aphrodisiac that my colleague spoke about, or the blood pressure medication I'm talking about, on a sustainable basis, we can allow the market forces to hold our currency where it has to be. And that requires the Bank of Ghana to do a lot more of the traditional things, ensuring that forex earnings are repatriated into the jurisdiction, ensuring that the banks don't hold the forex earnings in their nostro accounts, ensuring that the de-dollarization, as the chairman mentioned, really comes to bear. These things are not being done. It's the market intervention. And so, Mr. Speaker, today, as we commemorate and as we celebrate, my prayer is that we pay more attention to the sustainable things. The last thing, Mr. Speaker, is that a proper framework needs to be put in place. Is it 10 or 15 or 20 or 100% of the windfall that we are dumping on the market? And if we dump all of it when it is finished, what will happen? Mr. Speaker, we commend the various actors from 1965 who have worked to bring the Ghana cedi to where it is, and we pray the current administration to put in place a sustainable framework so that when gold prices are no longer at $4,000 on the world market, we do not see a further depreciation of the Ghana cedi. I thank Mr. Speaker for the opportunity.
Thank you very much. I'll take the last one. Okay, Shaibu.
Mr. Speaker, let me thank you very much for the opportunity and to thank the maker of the statement for teasing out a very critical issues regarding our economy and our city. Mr. Speaker, 60 years in the life of a living being, and indeed a city, is so important that we ought and need to celebrate it. Indeed, the Ghana cedi has traveled so many years. It has transitioned from one point to the other. And today we have a Ghana cedi that is stabilized. Speaker, my good friend made mention of aphrodisiacs. Let me be clear to point out that there are good aphrodisiacs and bad ones. And depending on the time that you inject the aphrodisiac, you will get the result that you want. Indeed, some years ago, some of aphrodisiacs were pumped into the system, and we got 17 Ghana cedis to the dollar. Indeed, today, a better aphrodisiac is pumped into the system, and we are hitting